if you are eating processed foods, on average, you're consuming about 500 additional calories per day. And a lot of people say, like, well, I'm not eating much. How am I gaining so much weight? And we have to look at the significant, dense calorie content of processed foods. Welcome back to another episode of the Real Health Podcast. Today, we're going to talk about the top 5 things in our environment that is making us sick, and then what to do about them. So the top 5 biggest issues that I see environmentally. So what's in our environment? What are we living in that we can absolutely make a change to that would directly improve our health outcome? And so today's really just about environmental health, and I want to make it really practical, because when you hear things like mold or plastics or toxins or air pollution and processed foods, right? It can feel sometimes overwhelming to make all these changes and just to like sell your house and go live in the woods, but that's not the goal, right? We're not going to live in a perfectly pure environment. It's impossible. So the goal today is just to identify those big rocks that we can get out of our backpack and help our bodies heal, right? Like, it's what I talk about a lot is bioaccumulation. It's the day in and day out accumulation of loads from heavy metals to plastic, petroleum to environmental toxins to mold that adds up or stockpiles and becomes a burden that we can't process anymore. So we can start today. Pick one out of the 5 today that you can directly start to make an impact with and help turn your health around. So these are going to be extremely practical. You may be doing some, maybe not all. Let's go through it. The first one, I think most of the listeners are doing this, but it is essential to communicate. You've got to remove processed foods. The first and biggest environmental problem isn't what we're breathing, it's what we're eating. And when it comes to a food environment dominated by products engineered to make them incredibly easy to consume, non-satiable, we want more. They're refined carbohydrates, they're added sugars, there's industrially formulated foods that just make it hyper palatable, right? And these calories come at a cost. When we look at the National Institute of Health study, we see that people eating an ultra-processed diet roughly consume 500 more calories per day and obviously gain significant more weight compared to those that ate, same individuals ate minimally processed foods. The variable was processed foods, right? So if you are eating processed foods, on average, you're consuming about 500 additional calories per day. And a lot of people say, like, well, I'm not eating much. How am I gaining so much weight? And we have to look at the significant, dense calorie content of processed foods. And we don't want to necessarily strive for perfection, because we're not going to be perfect here. But I would start with one rule. And the one rule is eat food that looks like food, right? Eat God food, not man food. So meat, eggs, vegetables, fruits, rice, potatoes, nuts, seeds, healthy oils, whole foods. That is what we should center our nutrition around. And so the challenge for the week is, let's get into our pantry. Let's look at the processed foods that are in our pantry, and let's just get anything that's over 15, 20 ingredients long, right? Those are processed foods. Even if it's organic, even if it's gluten-free, like when we're 10, 15, 20 ingredients in the list, that's an issue. That is a processed food item. You're like, but I bought it from Whole Foods. It's processed. But it says organic. It's processed if it has that many ingredients. So flip the labels around. Look at this week to see what foods you think are healthy, that have been labeled healthy but are truly processed. If it's over a dozen ingredients, chances are it's not healthy, and it's a processed food. Number 2, all right, indoor air. Air quality is of the utmost importance in driving a healthy environment internally, because we have more plastics in our environment and VOCs, volatile organic chemicals, and compounds in our environment than ever before. Everything is made of glues, of plastics, of petroleum, of formaldehyde, cancer-causing agents. It's in all of the furniture. It's in your bed. It's in your mattress, what you sleep on 8 hours a night. It's in the sheets. It's in your clothes. It's in your air quality, especially if you're in the kind of the Knoxville area, the East Tennessee region, right? As things get dampened, as you're in a basement setting. I mean, there's tons of mold exposure that we could potentially be breathing in. And so indoor air can contain particulate matter of like smoke and cooking emissions and allergens and excess moisture, mold-related contaminants, volatile organic compounds, radon, right? And we want to make sure that we are ventilating our homes because our homes could be making us sick. One of the best ways to reduce the environmental burden of toxins is to start with your bedroom. I mean, you spend nearly a third of your life in your bedroom if you sleep 8 hours a night. Think about the practicality of that, right? How much time are you spending in your home versus your bedroom? So in our bedrooms, we ventilate, we filter. We literally have a filtration unit running all night long. It's also kind of our natural sound machine. And as we ventilate and filter and control moisture, we remove these sources of toxins. And so a few practical changes is use a properly sized HEPA air filter. I think air purifier. I think you can just start at the basics. A HEPA air purifier is fantastic. Make sure you're changing your HVAC air filters on a monthly basis. I think there's we have a unit called a molecule, which is an air purifier, and it addresses more of the VOCs and chemicals. You can look at getting a little bit more of like a fancier upgrade to your air purifier, but most people would just benefit from a HEPA in their rooms and changing their HVAC air filters on a regular basis. Control the moisture, and those three things would add a lot of value to your air purification. And then just keep an eye out for any water damage because that is sneaky, as that builds a lot of sickness in patients with. If you have chronic sinusitis, chronic asthma-like symptoms, chronic allergy-like symptoms, eczema, we should be very mindful that there may be high mold environments in our home. Number 3, plastics and endocrine disruptors, like endocrine disrupting chemicals, and plastics are a major issue. And this is the category I think more families should understand without necessarily being afraid of everything around them. But when we look at food packaging, plastics, pesticides, cosmetics, personal care products, our household items, what we sleep on, what we put on our bodies, right? These are all endocrine disrupting chemicals, hormone disrupting chemicals that are affecting us at the hormonal cellular level. And we want to be mindful that these are cancer causing agents that we're living in. And so does that mean like drinking out of a plastic water bottle once every few weeks is causing significant damage? No. But if we're drinking out of plastic, heating up in plastic, putting on plastic clothing items, sleeping in plastic, right? That burden elevates over time, and we want to make it practical and minimize and eliminate where we can. So one of the biggest rule of thumbs, and I know most of you aren't doing this, but if you're doing this, you have to stop immediately. Right now, today, cannot heat up any items that are in plastic. All right? Do not even strain hot something, right? Boiling water in a plastic strainer. Do not put hot food items on plastic, quote unquote, plates or disposable plates. Do not consume hot items with plastic silverware. Heat plus plastic is something you really want to minimize. If you were to do anything, just avoid heat and plastic. That's where we get a ton more exposure to plastic in our environment. Don't microwave food in plastic. Store hot things in glass and Pyrex. Use glass and Pyrex when you can, or stainless steel, grade 18-8 stainless steel when you drink your water. Don't leave plastic water bottles cooking in a hot car and then drink that. You're like giving your kids, like, here's a water bottle, and they're sitting at the soccer game or baseball game. It's just sitting in their bag, and it's 105 heat index, and they're just drinking out of that plastic. I mean, it's a major endocrine disruptor. Put it in a big Stanley, put it in a big Yeti, right? Like, fill up their water bottles and use stainless steel or glass when you can. Replace heavily worn, like, plastic food containers. You know, I'm not going to say don't have any plastic food containers. I would encourage it, but, you know, if you still have it, at least make sure that it's cold. And reduce unnecessary fragrances. Fragrances are major endocrine disruptors. So a lot of the cosmetics and beauty items, we got to make sure aren't full of plastics, petroleums, parabens, as they can be detrimental to your hormonal system. So don't necessarily go home and throw everything out and be like, hey, I listened to this podcast. But these are things to be mindful of and start making upgrades as you slowly replace your home. Number 4 is the environmental toxin is light. We obviously live in a generation now that we can get light from any sources, flip on a switch, right? Turn a dial, and we've got instant light that disrupts our circadian rhythm. And light is not an issue. Light at the wrong time is the issue. And human biology evolved around an extremely predictable environmental signal, the sun, right? Light during the day, dark during the evening. Now we wake up indoors, work indoors, barely see the sunlight, stare at screens into the evening, get blue light exposure all the way in through the evening, and then turn every light on in the house at 9 p.m. and then wonder why, obviously, we're not sleeping well or waking up with energy. So light, based on your circadian biology, is essential to upgrading your sleep and overall performance. It's not about claiming that your iPhone is poisoning you. It's about respecting just simple circadian biology. Hey, when it's supposed to be light, have the lights on. When it's supposed to be dark, turn the lights off, right? Do blue light blocking glasses work? Yeah, they can if you're grinding at night and you truly do have to get something done, a project. Even if your kids are doing homework and it's 7:30 at night or 8 o'clock at night, don't disrupt their sleep by letting them grind on an iPad or a computer. Dim the screen down, take the blue light off, put the blue glasses on, and let them continue to roll. I think it's not perfection. It's making improvements. Make it practical, right? Getting outside and seeing the sun. If you're used to working indoors, or your mom that's indoors a lot, right? Like homeschooling and get outside, see the sunlight. It helps reset circadian biology. And before buying another just sleep supplement, consider resetting your circadian health by making sure you're cleaning up light environmental toxins. Number 5, the last one, is noise and constant stimulation. It's funny how when we look at this list, 2 of which are technology, right? Light and noise. But I do think that we are so used to being constantly stimulated. This is kind of like the sleeper on the list. You probably didn't think I was going to say noise, but we're surrounded by stimulation, traffic, honks and horns, notifications, podcasts, music, TV, right? Phones, kids' devices, dings and alerts and notifications and work messages and emails, right? Like, there's just constant noise. And many people rarely experience actual quiet. I mean, I get caught up in that, right? Like, even in my morning prayer time, I've got worship music on and I'm praying and worshiping at the same time. But do I take time to embrace the quiet, to embrace the moment of silence? And most of us, environmental noise, it's not just something that's annoying. Actually, the World Health Organization identifies excessive noise as a health risk associated with sleep disturbances and adverse cardiovascular, metabolic, and psychological outcomes. Research points to noise as being toxic to our biology. And I would broaden the practical conversation beyond just decibels to something I call nervous system load. Your nervous system can only process so much stimulation before it just it can't regulate anymore. Make it like super simple here, okay? Let's make it super practical for you. Let's try just 10 minutes once a day to be in complete quiet. That'd be a goal. Maybe you don't know what it's like to be in you're quiet, right? And when you start to try to get quiet, your mind starts racing. It's because you haven't trained the quiet, the stillness of the soul. And I would just encourage you, no podcast, no music, no scrolling, no television. Just sit and be, right? If you got a place outside in your backyard, just sit and be 10 minutes. Pray, breathe, sit quietly, meditate on a scripture. I think letting your nervous system experience stillness is so important to removing or improving the threshold by which you can function on a day-to-day basis. Your body has a total load, and we want to make sure we're not stockpiling that burden, that load, to a point where we're then having an inability to adapt and be resilient anymore, right? So it's not about one issue, right? It's cumulative factors, and so it's poor food quality, poor air quality, chemical exposure, circadian disruption to our biology, chronic noise and stimulation all add in to making us sicker. Our technology's great. Most of us can't control it well, and it's biting us in the rear. Technology with food, technology with lights, technology with noise and stimulation, technology in creating substances that we're putting in our home. All of these, they are a major factor in our health crisis that we're experiencing. So these are my top 5. I would say some very practical, just over the next week, a 7-day real health podcast environmental change. Number 1, food. Make at least 80% of what you eat less than 10 ingredients on a box, on a bag, or in the fridge. Try to be as whole food as possible. 80% of the food you eat this week are 10 ingredients or less in a single item. Number 2, air quality. Go home, check your HVAC air filters, change them if it's been a while, and go get a HEPA air filter and put it in your bedroom. Number 3, stop heating. So plastic, stop heating plastic up. That's it. Don't put anything warm in anything that's plastic. Number 4, I want you to see the sun and walk outside. Even if it's cloudy, you still get the benefit. Okay? 10 minutes a day. Be outside 10 minutes a day seeing the sun. Number 5, take 10 minutes, and this could be working together, 4 and 5, 10 minutes, and be still and quiet. Maybe pick 1, maybe pick 2, maybe even pick 3 things of that 5 list and start applying today, and I guarantee it'll upgrade your health if we do it consistently. What we do consistently is who we are becoming today. What we do consistently is who we are becoming tomorrow. Let's get consistent in our health disciplines, and let's make it super practical. It's not about peptides. It's not about injections. It's not about hormones. It's not about supplements. It's about practical living. Do the basic things well. It'll upgrade your health in the long run. Thanks for listening to another episode of the Real Health Podcast.